Policosanol is one of the most hyped cholesterol supplements online. A lot of people assume it is basically a natural statin. But here is what most labels do not tell you. In a careful 12-week placebo-controlled trial, sugarcane-derived policosanol, even at very high doses, did not lower LDL cholesterol more than placebo. So if you are taking it or thinking about taking it, you deserve the full story. In this video, you will learn what policosanol actually is, how it is supposed to work, what the research shows when you step back from the marketing, who should be careful because of interactions, and how to run a smart trial if you and your clinician decide it is worth trying. Quick safety reminder: do not change any supplements or medications without talking with a qualified clinician, especially if you take anything for cholesterol, blood pressure, diabetes, or blood clotting. So what is policosanol? Think of the waxy protective coating on plants. That wax helps the plant hold on to water and protects it from the environment. Policosanol is the name for a mixture of very long-chain fatty alcohols that can be extracted from those waxes. It is not one ingredient, it is a blend, and that blend can vary depending on the source and the processing. Many supplements are made from sugarcane wax. Some are made from rice bran, wheat germ, or beeswax. One common component is called octocosanol, but it is usually not alone. How does it work in the body? There are three simple ideas you will hear. First is the liver factory idea. Your liver makes a lot of the cholesterol that ends up in your blood. Some lab research suggests policosanol could influence steps in the cholesterol-making pathway. People compare it to statins, but that comparison is easy to overstate. Second is the liver cleanup idea. LDL particles circulate in your blood, and the liver clears them by pulling them out with LDL receptors. Some researchers have proposed that policosanol might support that clearance. Third is the clotting and circulation idea. Policosanol may mildly reduce platelet stickiness. Platelets help your blood clot. Less stickiness could support circulation, but it also means the main safety concern is bleeding risk when policosanol is combined with other blood-thinning agents. Does your body make policosanol on its own? No, it is not an essential nutrient. There is no known policosanol deficiency, and there is no target level you are trying to hit. So the real question is not do you need it, but does it help enough for your goal to justify the cost and the risk? Now let us get practical. You may see lists of foods that contain policosanols, like whole grains, wheat germ, and rice bran. That can be true in tiny amounts because policosanols live in waxy outer layers, but in a normal diet, those amounts are small. You are not going to reliably reach supplement doses from food, and you do not need to chase them. Food helps cholesterol mainly through soluble fiber, healthier fats, and overall pattern. So when would a policosanol supplement make sense? For most people, it is not a first-line move. It might make sense as a short, structured experiment if your LDL is mildly elevated, you are already improving lifestyle, and you want to see if your body responds. It does not make sense as a replacement for proven therapy if you have very high LDL, known heart disease, diabetes, kidney disease, or a strong family history of early heart events. If you do try it, typical doses used in studies are often around 5 to 20 milligrams per day, with 10 milligrams being common. Many protocols take it with the evening meal. Since this is a waxy, fat-soluble mixture, taking it with food is a practical absorption tip. Give it enough time to show an effect if it is going to. A common window is about 8 to 12 weeks. Then recheck labs. Quality matters because policosanol is a mixture. Look for clear dosing per capsule or tablet, a stated source, and some evidence of quality control, like third-party testing or good manufacturing practices. Be cautious with products that hide amounts inside proprietary blends or promise drug-like results. Cost varies, but a basic month supply at around 10 milligrams per day often lands somewhere in the range of about 10 to 30 US, sometimes more depending on brand and country. Now, who should consider it and who should avoid it? Since there is no deficiency, think in terms of fit and safety. Do a quick self-check. First, do you know your lipid numbers from a recent test? If you do not, start there. Second, do you have higher risk features like smoking, high blood pressure, diabetes, kidney disease, or a close relative with early heart disease? If yes, focus on proven treatment and do not rely on Policosanol. Third, are you taking anything that thins the blood? If yes, Policosanol needs extra caution or may not be appropriate. Lab tests to discuss with your clinician include a lipid panel and often ApoB. If you decide to trial a supplement, set a date to repeat your labs so you are not guessing. Let us make it real with 3 quick personas. If you are a budget eater, your best move is a daily soluble fiber habit in fewer saturated fats. If you still want to try Policosanol, only do it if you can also afford the follow-up lab work. If you are vegan, keep most of your calories coming from whole foods and watch saturated fats from coconut and palm oils. Policosanol, being plant-derived, does not guarantee it will lower LDL for you, so measure, do not assume. If you have a health condition like diabetes or existing heart disease, treat Policosanol as optional at best. Do not swap it in for medication, and do not start it without your clinician if you take aspirin or any prescription blood thinners. Now for the evidence reality check. The research on Policosanol has a strange pattern. Many early studies, mostly from one research ecosystem, reported large drops in LDL and total cholesterol with small doses. But when independent groups tested Policosanol in rigorous trials, the results often did not match. In one multi-center trial with 143 people, participants took sugarcane-derived Policosanol at doses from 10 up to 80 milligrams per day for 12 weeks, and LDL did not drop more than placebo. Other trials outside that early research cluster have also reported little to no lipid effect. So, how strong is the evidence for lowering LDL? In plain language, the research strength is mixed and often unreliable. That does not mean Policosanol does nothing. There is research suggesting possible effects on platelets and other markers, but those areas are earlier, the studies are often smaller, and we do not have strong evidence that it reduces heart events. Now, safety. Many people tolerate Policosanol well. The most common side effects reported are headache and stomach upset. Next are trouble sleeping and dizziness. Less commonly, people report flushing or a mild rash. If you start it and you feel worse, stop. The interaction that matters most is bleeding risk. Because Policosanol may reduce platelet stickiness, be cautious with anticoagulants and antiplatelet drugs, such as warfarin, aspirin, and prescription antiplatelets like clopidogrel. Also be cautious if you stack multiple supplements that can affect clotting, like high-dose fish oil, garlic extracts, ginkgo, or concentrated curcumin. If you have surgery or a dental procedure coming up, ask your clinician whether you should stop it ahead of time. Special populations should be conservative. In pregnancy and breastfeeding, skip it due to limited safety data. If you have a bleeding disorder or a history of serious bleeding, avoid it unless a specialist advises otherwise. Red flags that mean stop and get medical help include signs of an allergic reaction like swelling, hives or trouble breathing, fainting, and any unusual bleeding, such as black stools, vomiting blood, repeated nosebleeds, or large unexplained bruises. Now, a quick myth lightning round. Myth 1. Policosanol is a natural statin. Reality: it is not. And cholesterol-lowering results are not consistently reproduced. Myth 2. More is always better. Reality: higher doses have not reliably produced bigger LDL drops, and they can increase side effects and cost. Myth 3. You can get a meaningful dose from food. Reality: foods may contain traces, but food helps cholesterol mainly through fiber and fat quality. Let us wrap it up. Policosanol is a mixture of long-chain fatty alcohols extracted from plant waxes. It has plausible mechanisms, but meaningful LDL reduction is not consistently supported in independent trials. If you want to try it, do it like an experiment. Choose a quality product, take a common dose with a meal, and recheck your lipids after about 8 to 12 weeks with your clinician involved, especially if you take anything that affects clotting. Your one action for today is simple and powerful. Add 1 serving of soluble fiber, oats most days, beans or lentils several times per week, or psyllium and water if that fits your routine. Start low with psyllium and drink plenty of water, and check with your clinician if you have swallowing issues or significant gut problems. Now, I want to hear from you. Have you tried Policosanol, and did you measure your cholesterol before and after? What dose did you use, and for how long? Share your experience in the comments, and let us know what supplement you would like to learn about next.